95.1 The Peak, it is Talk of the Town with John and Melanie, and joining us from the Best You is Dr. Deniz Akyurekli. Doctor, thank you so much for joining us here on Talk of the Town. Let's first introduce folks to what the Best You is.
Okay, wonderful. Hi, John. Glad to be here. So the Best You is a medical aesthetic service. We help enhance people's appearance.
So medical aesthetics, would you be referred to by a doctor?
So you can be referred to by a doctor, or, because it's private services, people can call and arrange their own appointments.
And what are some of the services that you do? I mean, it's pretty broad, I imagine.
It is, yeah. So, mostly what we do is we treat kind of the effects of chronic sun exposure, right? So lots of things that are related to aging are relating to sun exposure. So basically, we treat aging skin. We treat people with lesions that they have that they don't want. We help people reduce their hair, with laser procedures. So we have a variety of services from medical aesthetics, including injectables to reduce wrinkles and rejuvenate the appearance of the face. We have other services that are laser-based or light-based that help reduce hair. So things like that. And we offer a lot of over-the-counter topical products to assist in all this as well.
Doctor, a lot of people, I think the whole medical aesthetics world continues to grow. Where do you see the popularity coming from? Why now all of a sudden are folks really interested in this?
Well, I think people have always kind of been interested in it. This is something that is a little bit elusive. It must be something related to our culture, and I think people have always kind of looked at themselves and there's things that they focus on that they want to change, and it may be how we are as a society, and wanting to look younger and feeling that there's more opportunity in being young. I'm not sure. But, it is there. Most recently, I think there's an increase in popularity because a lot of people are spending time on the computer and looking at their own image, and that kind of further reinforces, the thoughts that they have in the head. One thing that we kind of focus on is the fact that, when people come to us, they're actually perfect as they are. There's nothing that has to change, right? We, though, as individuals, focus on ourselves a lot, and so it's kind of how our perception is about ourselves, that we want to change things.
Do you ever advise folks that maybe it isn't the right thing, that maybe it's just a feeling that they have that they need an enhancement, that perhaps there's not really anything medically that needs to be done?
Yeah, this is how we open all of our conversations. The reality is that there's nothing that needs to be done. There's nothing that has to be done, right? I mean, people are perfect as they are. We're starting with perfection, and what we're treating is perception, right?
So in some ways, it's a mindset, but it could also work the other way. In other words, a slight medical enhancement that might seem almost imperceptible to others could be a big deal to someone.
That's exactly the truth. Yeah, that's what happens. Yeah. So, people, that's the thing. So, we look at the medical aesthetics kind of as a bridge, right? So people present to us, they are perfect, but in their minds, there's a problem. And it's something that they focus on and spend energy on. And the whole idea is to provide them with a solution so that, not to make them a perfect image or, to perfect or to make them look perfect. The whole idea is to basically, make it so they no longer have to focus on that, right? That you solve that problem, and then their energy can be spent elsewhere in something better.
These are surgeries. Are they relatively invasive?
No, so there's a whole spectrum of services, right? All the way from, just over-the-counter products to surgery. So, and in between you have injectables, that are relatively low risk, and you have laser and light procedures that are relatively low risk, all the way up to the surgeries, which also are, they carry a little bit more risk and it's more invasive, but still relatively low risk. Things like liposuction and facelifts and whatnot.
Is there anyone that should avoid medical aesthetics? Is there a typical patient you go, no, this definitely isn't for you?
Well, yeah, so there are certain medical contraindications, right? If somebody isn't medically fit to do it, but more so, I think if people have, some, not healthy kind of goals, right? So if it's somebody who is overly obsessed with their image, and there appears to be that, doing this is just going to continue to feed the problem or exacerbate their problem, then that would be somebody to avoid. Somebody who's really young, who's looking to do something unusual, would be not right. Or people doing things to kind of for the wrong reason.
Right.
If they were doing it because they wanted to impress somebody else or to do it for somebody else, then that's not a reason to do it, because you're kind of guaranteed to fail there.
Dr. Deniz Akyurekli is with The Best You. Doctor, great talking to you, and I look forward to checking in with you and your colleagues as we go through this.
Okay, thank you. It was a pleasure speaking with you.